Today is our 2037th day of continuous webinar. Welcome all the participants for today's English session. Before beginning the session, we'll have a silent prayer. Okay, today's our speaker is Dr. Rajneesh Kumar Sharma. He is BHMS, MBBS, MD in Homeopathy, DI in Homeopathy, and DLit from UK and PhD, Chief Managing Director of Homeocure and Research Institute, wife of Homeopathic Pharma and Sparsh Multi-Specialty Hospital, Executive Member of Delhi Homeopathic Medical Association and life member of many associations like Homeopathic Medical Association, Indian Medical Association, and faculty of several national and international conference, author of many research paper, recipient of many awards like Homeo Gem Award, Gold Star Award, Lifetime Achievement Award, and author of many research papers, faculty of several national and international conference, and many we have to say about Dr. Rajneesh Kumar. If I'm saying the complete profile means it will take 1 hour to finish the session. So without any delay, I'm inviting Dr. Rajneesh Kumar for today's session. We are so happy to get you as a speaker of today. You are welcome, sir. Please.
Thank you for inviting me for
Dr.
giving my...
Yeah, Dr. Ajani, I have made you the host. Yes.
Okay. I'll make you as a doctor. You can share. Now you're the.
I'm just starting without delay.
Okay.
Today's topic is carcinogenesis, which is also called as oncogenesis, the initiation of cancer inside a living body, inside a living healthy body, which is triggered by a series of events, including so-called modern science events like oncogens, viruses, fungi, and a number of radiations and chemicals and exposures, etc., and some unknown causes. But in homeopathy, we have to discuss in the mirror of miasms, which may lead to this condition, carcinogenesis. We have to see carcinogenesis, growth, metastasis integrated with miasmatic analysis and homeopathy. Today, I am having some sort of viral fever, and pardon me for some hindrance in my voice. First of all, we should see the fundamentals of miasmatic theory in very short. Miasm is nothing. It is a process. It is an energy which puts its effect on catalyst available inside the living organism, or each and every reaction which is mediated by catalyst. The miasm, they alter, they affect the catalyst, and they process the phenomena which decide the direction and destiny of the reactions, especially the biochemical reaction occurring inside the living organism. I will be discussing 5 miasms: Sora, syphilis, psychosis, pseudosora, and cancer miasm, and a number of combinations may be there, but I will be discussing only 5 because I am making the 5-layer picture of a cancer. The core idea, the philosophy is there. There is a same molecule. There is a same body. In same body, there is same molecule. In the presence of different type of catalyst, the reactions, they change their pathways, and destiny is changed, and result is changed. And there is a result in the form of different type of disease. Again, in the same body, the same molecule is there, and a number of reactions are occurring there. And in the presence of different type of catalyst, in the different type of catalyst and different conditions of the catalyst, the reaction changes and the products are changed and disease is produced. First of all, SORA, which is a reversible functional imbalance. There is a reaction. There are numerous reactions inside the body, but I have picked a single reaction which is occurring in the liver cell of the organism. CO2 plus H2O. Carbon dioxide, it reacts with water, and it makes bicarbonate, H2CO3. This is very slow reaction. In the presence of carbonic anhydrase enzyme, which is freely available inside the hepatic cells, if there is association of the zinc ion, the reactions become super fast. It becomes 6 times greater than normal reaction. What SORA creates? SORA pushes the zinc ion inside the reaction as a catalyst, and the reaction becomes very fast. And if the zinc ion is removed from that particular reaction, the reaction is sluggish, or it stops, or sometimes it may become in opposite direction. It may be the reversible reaction also. This is the slight reversible functional disbalance that is created by SORA in the form of zinc ion. This is reversible. There are no toxic byproducts. There is no accumulation. The substance created H2CO3 is water soluble and it is removed easily from the body, and it is non-toxic. Thus, the SORA represents the functional disharmony without structural changes, and system reacts excessively and inadequately, but remains in self-correction stage, like production of transient symptoms, anxiety, acidity, hypersensitivity, and several other conditions can be developed with effect of SORA in this manner. We can explain with a number of reactions which are affected by SORA, and all the reactions are temporary. Now, psychosis. Psychosis leads to accumulation and fixation of the substances. There is again a reaction. This reaction is in neuron. Dopamine reacts with oxygen and it oxidizes into quinones. When psychosis is there, it pushes the ions in the form of catalyst in the reaction, and quinones are further assimilated into neuromelanin. Neuromelanin is an insoluble substance, and it gets collected into the neurons, inside the neurons and interneuron spaces also, affecting and hampering the normal phenomena of the nerve tissues. And it is insoluble and cannot be eliminated by the body. Thus, the pathway diverts from quinones, neuromelanin is produced, which is insoluble end product, and body cannot eliminate. There is failure of elimination, and there is excess reaction with retention. This is psychosis. The result is growth, cyst, pigmentation, thickened tissues, chronic congestion. A number of reactions can be explained with help of psychosis. Syphilis, which is a destruction condition. There is a reaction inside the mitochondria. The tryptophan gets converted into kynurenine. When there is a salt, any salt of inflammation is there, indole amine 2,3-dioxygenase enzyme is secreted, and that leads to conversion of kyneuron into the quinolinic acid. And this quinolinic acid is very toxic to cell itself. It kills the mitochondria, it kills the cell itself, and it kills the whole organism, producing a number of symptoms. The same substance becomes toxic. Tryptophan is very essential to the body, and it is non-toxic, but it is converted into quinolinic acid in the pathway. But when pathway change with syphilis, and destruction takes place. This is endogenous cell poisoning, and there is progressive degeneration leading to syphilitic stage. The syphilis is a reaction turned against the organism itself. The organism kills himself. The ulcerations, necrosis, psychosis, congenital degenerations are the examples. There are a number of reactions which can be explained over here. Again, pseudosora. This is instability and stage of oscillation. Stagnation, appearance of the symptom, suppression of the symptom, and disappearance of the symptom, then again changeability. These are the symptoms produced by tubercle miasm. There is a reaction. This is again in mitochondria. Oxygen combines with electron and becomes negatively charged, producing ATP, and this ATP reacts with the body, and the overcharged oxygen molecule, which is negatively charged oxygen molecule, it destroys the tissue, and after the reaction is over, when this is secreted under hypoxia and stress stage. Actually, whenever there is hypoxic stage, the lack of oxygen, or there is a lot of stress, this reaction will start, and there will be ATP production, and negatively charged oxygen molecule will be there, which will be destroying the tissues. And after the stress or hypoxic stage is over, the reaction becomes reversible, and re-repair takes place, and repair and re-repair they lead to granuloma formation and small tumor type condition they develop. This is rapid shift between energy production and oxidative stress, alternating stage between construction and breakdown, and there is high metabolic volatility. Pseudosora is restless instability and neither fixed nor fully destructive. Therefore, there are alternating stage. This is oscillating stage, wasting with excitability, relapsing illness, and rapid progression of the diseases. Now, cancer miasm, which is autonomous proliferation. Everything is autonomous. Nothing is under control. There is a liver reaction. This is biochemical reaction in the hepatic tissue. Glucose is converted into lactate. This is normal phenomena. When cancer miasm becomes activated, this reaction takes place despite oxygen. Even in absence of oxygen, glucose keeps on converting into lactate, and the lactate is very toxic, and it leads to progression, proliferation, destruction, hyperactivity of the cells, and aerobic glycolysis fails, anaerobic glycolysis starts, and there is loss of regulatory feedback. There is endless proliferation, and survival is rewards from organism needs. And cancer miasm represent autonomy without obedience. Cells live for themselves. They are under not any control. They live for themselves autonomously. There is relentless growth, suppression of apoptosis, and there is exhaustion of the host, ultimately ending in the death. What the homeopathy remedy do? They just do catalytic correction. Homeopathy remedy just do corrections in catalytic activities, and reactions become normal, and the living body becomes harmonious and normal. There is no material substitution, there is no suppression. This is the summary. Sora reacts, syphilis destroys, pseudosora oscillates, relapsing conditions, psychosis retains and gets accumulation, and cancer rebels autonomous. This is unified miasmatic matrix. Sora, reversible imbalance, restorable equilibrium is there. Pseudosora oscillation, metabolic instability is there. Psychosis accumulation, insoluble fixation is there. Syphilis inversion, endogenous toxicity is there. Cancer autonomy, unchecked proliferation is there, resulting in the growth. Now we will be discussing fundamental of oncology concepts. There are certain concepts which are related to oncology. First concept is carcinogenesis is multi-stage condition. This is not single stage. Cancer develops in multi-stages. First stage is initiation. Second one is promotion. And third one is progression. We will discuss in the next slides. Another concept is host versus tumor. The host tries to get rid of that particular type of oncogenesis process. This is elimination. Sometimes host fails and cannot eliminate the condition. It makes the equilibrium with the cancer mechanism and lives with cancer process. The cancer becomes either benign or becomes slow progressing or become to grow independently without any control. Can you please tell me which slide I was? Okay.
Sir, please scroll down. So we'll.
Yeah. Have you listened to this pseudosora syphilis?
Yeah.
This was okay?
Now I'm seeing the first slide, but can you press the sixth or fifth slide? Yeah. Now it is visible. Okay.
I think we have discussed the Sora.
Yeah, we finished these slides. I just for testing.
Pseudosora has been finished because I was just continuing on next slides, but I did not know I was after that.
Okay. Sir, please.
This was discussed.
I think. Yeah.
Again.
No. From this from cancer miasm onwards, we'll continue again. No,
okay.
Not this much.
Let us discuss.
Okay.
Okay. Let us discuss from cancer again. Let me revise. The syphilis, this is destructive inversion. There is a reaction in the neuron.
We finished. Just to go through.
Okay. This is the reaction occurring in the neurons. The tryptophan gets converted into kynurin in the presence of indolamine 2,3 deoxygenase enzyme, which is secreted during inflammation. Chronic inflammation or acute inflammation, in both conditions it is secreted, and the tryptophan is converted to kynurin. And whenever IDO is in excessive amount, the kynurin is further converted to quinolinic acid, which is very toxic, and it kills the cell itself. This is a syphilitic condition. The same substance which was not toxic becomes toxic, and there is endogenous cell poisoning, which progressive degeneration. This is a condition of syphilis leading to ulceration, necrosis, psychosis, congenital degeneration. Again, the pseudosora, which is tubercular miasm having instability and oscillation. There is a biochemical reaction inside the liver. This is provoked under hypoxia or stress condition. Oxygen molecule combined with electron and releases an ATP. The oxygen molecule becomes negatively charged and it injures the cell itself. And whenever the stress is over or oxygen supply is again there, the ATP is not produced. Oxygen is again in negative. Pardon? I am audible?
Yes, yes. There is some disturbance from the participant side.
Okay. Whenever the hypoxic condition is over or stress is over, the reaction becomes reversible and oxygen releases its electron with absorption of ATP, and the repair begins in the cell, and thus the injury and repair, this condition develops, oscillatory stage develops, which is pseudosoric condition or tubercular condition, and it leads to development of granulomas. This is the characteristic feature of tubercular miasm. The pseudosora is restless instability, neither fixed nor fully destructive, and causes alternating states, wasting with excitability, relapsing illness, and rapid progression. Cancer miasm, this is autonomous proliferation. There is a reaction, glucose converts into lactate in presence of oxygen, but whenever cancer miasm is prevailing, the reaction becomes autonomous, and despite oxygen, glucose keeps on converting into lactate, leading to a number of reactions which are unwanted reaction, uncontrolled reaction, and these uncontrolled reactions may lead to cancer condition. This is the example of cancer miasm. The normal reaction becomes uncontrolled, and there is relentless growth, suppression of apoptosis, and there is exhaustion of the host, and lastly, the death of the organism. What homeopathy remedy do? It does the corrections in the catalysts. The homeopathy remedies do catalytic corrections, and the catalytic correction leads to restoration of the normal reactions, and the system becomes harmonious and healthy, and there is a recovery, complete recovery of the individual. This is a summary. Sora reacts, syphilis destroys, pseudosora oscillates, psychosis retains, and cancer rebels, becomes autonomous. Sora has reversible imbalance and there is restorable equilibrium. Pseudosora has oscillations, changeable states, leading to metabolic instability. Psychosis has accumulation, having insoluble fixation of the conditions. Syphilis has inversion, and there is endogenous toxicity, and cancer has autonomy with unchecked proliferation. There are certain concepts related to oncology. First one is carcinogenesis is multi-stage condition. It is not easy condition. It is a multi-stage condition. First one is initiation of the carcinogenesis. Second is promotion of carcinogenesis. And third one is the progression of the carcinogenesis. We will discuss in the later slides. There is host versus tumor reaction. Host tries to eliminate the cancer mechanism. Sometimes it fails. It makes the equilibrium with the cancer process and lives with cancer in benign condition or slow progressing condition or dormant condition. And third one is the escape model, when body surrenders and leaves the cancer itself to develop without any control. And another one is tumor microenvironment, which is a very complex ecology consisting of stromal cells, cap cell, TAM cell, ACM vasculature, and a number of cells with progression, angiogenesis, tumorization, invasion, and resistance to the traditional therapies. Next concept is metastasis, which is a complex multi-step cascade having invasion, intravasation, survival in circulation, extravasation, colonization, and metastasis. Metastasis to the most affinity organs, organ-specific interactions are there. These other abbreviations I was using: tumor microenvironment, cancer-associated fibroblast, tumor-associated macrophages, extracellular matrix, vascular endothelial growth factors, type 2 macrophages, regulatory T cells, lysyl oxidase enzyme, etc. Number of. This is epigenetics and cancer. Carcinogenesis is a multi-stage condition. Initiation, then promotion, then progression. Host, what is the reaction between host and tumor? Either elimination of the cancer, either equilibrium with the cancer, or escape, the surrendering against the cancer. Next concept is tumor microenvironment, having complex of the cascade of the cells and tissues and mediators, metastasis, invasion, intravascular angiogenesis, etc. Now, we have to see the multi-stage carcinogenesis. There are a number of microevents in this matter. First of all, there is initiation of the cancer. In day-to-day life, there is damage to DNA, and the DNA gets repaired with a number of processes, and it restores the healthy life in a routine practice. But sometimes DNA parts or some DNA becomes injured and they are left unrepaired. Which causes the unrepaired the DNA, the existence of unrepaired DNA? That is SORA. SORA causes carcinogenesis in the form of carcinogen, oxidative states, telomerase dysfunction, viral conditions, replication stress, radiations, pollutions, and number of triggers may be there. And there may be failure of DNA repair genes like BRCA and 1 and 2. There are tumor suppressor genes are there, which are activated by the presence of SORA, and SORA leads to failure in repair of DNA, and this triggers the initiation of the oncogenesis in genomic or epigenomic hits. Next one is promotion. Promotion is mediated by psychosis, no mutational expansion, chronic inflammation, growth signal, and TME amplify initiate clone through proliferate signals. Psychosis supports the promotion of the tumor cells with help of a number of biochemical series and epigenomic series. There is epigenetic reprogramming and altered metabolism, which leads to systemic symptoms also. Then there is progression. There is genomic instability, selection of aggressive phenotypes is there, and there is invasion of a number of machinery like MMPs, integrin modeling, clonal heterogeneity develops, and there is therapy resistance condition. The body becomes resistant to each and every sort of chemotherapy or remedies. Now, body reacts, and there is immune surveillance, immunoediting is there. Either body eliminates the cancer, or body compromises and makes the equilibrium, and it lives with the cancer in dormant condition, benign condition, or slow progression, or sometime body escapes and leads to development of free cancer. Then tumor microenvironment, I have already stated. This is a complex ecology. It has a number of cells, TMF, CAMF, STEM, endothelial cells, nerves, ECM stiffness, and hypoxia zone. What is a hypoxia zone? A space occupying lesion. That when tumor develops, there is development of a space occupying lesion. It exert the pressure on surrounding tissue as well as on its center also, its core also. Due to pressure exerted on its core, the blood vessel that gets compressed inside the tumor, and the hypoxic zone develops inside the tumor body. And inside the tumor body, there develops necrosis. And this necrosis creates rupture of the cells, release of the toxins, and tumoro-ulcerative growths they appear, and they prepare soil for metastasis. These are the components I have already explained. Then metastasis, this is cascade and modern refinement. Cascade includes intravasation, survival in circulation, arrest at target organ, extravasation, dormancy, awakening, and colonization, which in the form of metastasis. Cancer stem cells with self-renewal, exosomal signaling, they prepare distant metastatic Nikes, and in presence of chemokines, they develop organotropism. They go for a particular organ, and in the most suitable organ, they get metastasized. There is dormancy and awakening. This is controlled by pseudosora or tubercular miasm. Disseminated tumor cell can enter non-proliferative dormant state for a long time, And whenever the environment is okay, they get awakened again. There is exosome and pre-metastatic naive. This is just before metastasis. Tumor-derived extracellular vesicles, which are also known as exosomes. Exosomes are the vesicles which are secreted by the tumors in the extracellular material. They carry protein, miRNA, and lipids, and they remotely modify the target tissue stroma, and they recruit bone marrow-derived cells, and they prepare soil for metastasis at distant places, and they get soil, fertile soil for the further development of the malignant disease. And sometimes the primary site disappears and only secondaries they survive. Then we write the secondary of secondaries with unknown primaries. Now we have to learn the miasmatic mapping. There is initiation, which is triggered by SORA. This is constitutional susceptibility. Lifelong constitutional weakness, chilliness, eruption, suppression in childhood, sensitivity to small triggers, family history of chronic degenerative diseases. They are soil for SORA. SORA allows DNA damage to persist. It fails the repair of the DNA, and it fails the detox pathways and prepares the initiation condition of the carcinogenesis. This is the summary initiation by SORA. There is DNA damage, which gets unrepaired. There are genetic mutations, and there is chronic inflammation. Again, next step, psychosis. It leads to promotion of the oncogenesis, carcinogenesis. There is proliferation of the cells. There is angiogenesis. There is immune invasion. Third stage, there is further progression in the presence of syphilitic miasm and cancer miasm. There is tumor invasion, metastasis potential develops, and resistance to treatment develops. In fourth stage, along with syphilis, SORA associates and tubercular miasm develops, and tubercular and cancer miasm they combinedly lead to slow growth, minimal symptoms, and latent tumor cells. Dormancy starts. And fifth stage, the metastasis takes place due to syphilitic activity in the presence of cancer miasm, because syphilis leads to necrosis of the tumor cells, and the toxin released by the tumor cells, they lead to metastasis and prepare soil in the form of exosomes. This is promotion by psychotic miasm, chronic proliferation responses, mucous secretory chronicity like warts, condylomata, chronic catarrhs, obstructive swellings, tendency to overproduce polyps, hyperplasias, and overreactive condition is there, generating excessive repair that favors the clonal expansion. Needed repair work is there, and there is destruction. There is accumulation of the tissues. This is progression and invasion by destructive remodeling. The syphilitic miasm gets activated in the presence of cancer miasm and leads to ulceration, destructive process, indurations, deep aching pains, rapid tissue breakdowns, cachexias, odd manifestation not matching common patterns. Miasmatic explanation is there. Boundary regulation fails and lesion become infiltrative because there is destruction of the core of the tumor cell, and tumor cells get ruptured, they become necrosed and release exosomes, and they become infiltrative. Then tubercular miasm, the condition become dormant. There are signs of wasting, there are signs of recovery, there are cyclic symptoms, history of intermittent infection and wasting illness, and maybe family history of cancer. There is periodicity, there are fluctuation of the symptoms, and there is characteristic tubercular stage. There is cancerinic condition developing afterwards. Now, metastasis, there is systemic spread, dominant cancer miasm and syphilitic miasm. They combinedly lead to metastasis. There is loss of integumentary integrity. There is fixed despair, deep entry disturbance, rapid systemic decline, and organ-specific dysfunctions. When deeper miasm dominate, we have to expect the systemic collapse rather than an isolated local disease. This is systemic disease, not the local one. What is the homeopathic strategy now? Full constitutional case taking is needed. mental, emotional, childhood history, infectious history, family history, modality, fetal history, everything is to be correlated in the treatment of the cancer. There must be targeted repertorization. There are two types of repertorization. One repertorization is constitutional repertorization, including mental, physical, and sufferings. We have to include pathological symptoms also. This the symptoms of cancer also, the symptom of the sufferings also, like pains, burning, numbness, and site of the cancer, metastatic site of the cancer. We have to include each and everything so that the most minimum remedy can be ascertained. And there should be single remedy approach for clarity. We should avoid polypharmacy, especially in fragile patients. There must be a use of intercurrent remedy. We have to decide, we have to diagnose which miasm is active at that particular time, in which stage the patient is coming to our clinic, whether it is in initiation stage, progression stage, proliferation stage, metastatic stage, whatever the stage may be, we have to decide which miasm is most active at that particular time, and we have to use anti-miasmatic remedies accordingly. We have to decide whether it is psoric condition, psychotic condition, syphilitic, pseudopsoric, or mixed condition. We have to decide accordingly. We have to use nosodes accordingly. First, initial consultation is needed, and acute remedy can be given for the immediate relief of the patient for first time. Then constitutional remedy is needed to treat the condition by roots, and then stage 1 remedy, which miasm is most active at that time, and then stage 2 remedy, which miasm is under the that particular miasm, like cancer miasm. Practical homeopathic strategy: as soon as growth is initiated, we have to improve the body by detoxing, by repairing, and improving the immune tone and correction of the psoric ground. We have to use single constitutional remedy, and lifestyle counseling to give up smoking, to give up alcohol, or avoid the triggers. And we have to provide good nutrition, vitamin D, vitamin C, etc. And immunomodulatory symptoms remedy we have to use, like sulfur, calcium, phosphorus, any remedy which is indicated at that particular time. And potency, of course, must be medium to high potency without quick repetitions. Infrequent doses must be there. And each and every dose and each and every change must be well documented. Then we have to see the body's response, the stage of elimination. When cancer is being eliminated by the body, we have to support the immunity of the body. We have to reduce the chronic inflammation inside the body. We have to support the body only. We have to give the remedy on the basis of family history, like family history of tuberculosis, family history of cancer, carcinosis, and so on. Yes, number of remedies can be there. The next stage, when body fails and makes an equilibrium with the cancer and lives with cancer, we have to support the remedy, and we have to remove the miasmatic block along the immunity recovery. Remedy may be Thuja for psychotic block, mercury or lac acid, etc. Number of remedies for syphilitic block or psoric block, anything. We have to give a remedy in medium to high potency without any repetition. In next stage, when tumor has been grown and local expansion is there and local symptoms are there due to compression, due to pressure of the tumor, due to nerve injury is there, nerve compression is there, bone erosion is there, or local pressure, any symptom, lymphatic drainage is hampered, or whatever the symptom may be due to local involvement, the palliation should be done. The palliation of local symptom is very necessary to improve the quality of life of the patient, like breast environment stitching, vital caponium, of course, bone pain and neuralgic shooting, hypericum may be given, a number of colocin may be given, and LMCPA may be given, liver induration and aching in liver region, chelidonium, lycopodium, cardiocin, and so on. We can use homeopathy as adjunct therapy also. If patient is taking another modern treatment or another treatment with an oncologist, we can give homeopathy as adjunct therapy, and we should not discontinue the therapy the patient is taking for the fear of medico-legal complications, as homeopaths are not supposed to be oncologists by the court of law. When condition becomes beyond control, the deeper intercurrent palliation is needed. Metastasis had taken place, a number of destructive conditions are developed, and patient is suffering a lot. We have to improve the quality of life, reduce suffering, and we have to improve the host response to the systemic therapy the patient is taking, either homeopathy or modern therapy or any sort of treatment he is taking. We have to support the quality of life. We can give carcinogenesis modifier, serenum, in high potency, of course, in highest potency is available. And we can use low potency drugs for local problems like phosphorus, carbogage, and for mental palliation, ignatia, nerve, populus, etc. Number of remedies. And we have to prioritize palliative oncology intervention where indicated. When metastasis has taken place and remote metastasis has taken place in the exhaustive condition, and there is severe cachexia and patient is suffering a lot, the only symptom relief can be done. We have to reduce the suffering and support the system through systemic therapy. We have to choose the remedies superficially, like burning anxiety, systemic obstruction, arsenic, induration of gland, sinking, vertigo, conium. And intercurrent remedy, of course, thuja, carcinosin, nitric acid, lactic acid, whatever indicated. And hypericum for neuropathic conditions, and stitching pains versus by motion, hernia, of course. And we have to follow the WHO guidelines for pain conditions, pain scores, and so on. We have to support conventional therapies like surgery, chemotherapy, radiotherapy, targeted therapies, immunotherapies, brachytherapies, and number of therapies are there available in modern science. We should support. We should not refuse the condition, refuse the treatments. We should promote the patient. We should promote the condition to get treated with oncologist. We have to treat the patient for his life. We have not to prove himself ourselves. For we are home patient, we will treat with homeopathy only. We will give timely referrals. We should not delay. We have to minimize toxicity, manage the side effects of the treatments. We have to prevent the treatment interruptions. We can treat the side effects of the treatments. Their common remedy for support may be Naxomica, Apicoc for nausea. For mucositis, we can apply calendula, Maxol, Borax, and Belladonna for inflammations, neutropenia, weakness. Whenever there is life-threatening condition, we should immediately refer the patient without delay for a particular type of hospital or oncologist. And written consent must be taken by the patient or their attendant in handwriting that we are taking this homeopathic treatment on our own risks, and we know all the outcomes and we know the limitations and limitations of the treatment we are taking with an homeopath. Failure, complications of treatment. Emergency symptom management should be done, like severe diarrhea, septic signs. Immediately medical care is needed, either homeopathy or an emergency medicine. Like febrile neutropenia, this is an emergency condition. Immediately the patient should be referred for a hospital management without delay to avoid the negligence, to avoid the mishap. Any new fever, septic signs, organ failure, urgent oncology emergency referral is needed. These are the red flags. We should not treat the patient if there is urgency. Homeopathic support can be combined with miasmatic prescribing and constitutional therapy, and even with modern treatment also. We can use homeopathy as adjunct therapy, and there is a great success in treating the terminal cases also. We have to take full case and choose constitutional remedy, determine whether nosode or intercurrent is needed. We have to set the potency, we have to set the follow-up plans, and we have to document each and everything, and we have to document outcomes also. As per guidance of the WHO, we have to write down all the things, and pain scales should be used, and carcinosin, etc. Number of remedies can be used here. For better results, early detection is the need. We must go for immediate lab test, radiological tests. Early detection is necessary. We should go for FNAC, we should go for biopsy. There is a case a few years ago in Malda of West Bengal. There was a homeopath who was treating a sebaceous cyst of a female breast, and that was normal cyst, that was sebaceous cyst, of course, but within 6 months it could not be treated well, and was turned into malignancy. And at Tata Memorial Center, that was well diagnosed into squamous cell carcinoma, and the radical mastectomy was done, chemotherapy, radiotherapy was done, and afterward, the attendant of the patient, they took the shelter of the court, and homeopathic doctor at Malda was punished with the High Court, and that was annulled. And the courts stated that the homeopathy doctor, he was not an oncologist and he should not treat the cancer's conditions. And this is the true case of negligence. He failed to diagnose the cancer condition at time, in proper time, and the condition worsened. We have to avoid these medical legal conditions. The early diagnosis is of two types: modern diagnosis, FNAC, biopsy, screening, tumor marker test, laboratory test, and number of tests are there. And in homeopathy, we have to do miasmatic scanning also. Miasmatic scanning is a careful case taking and the ascertainment of the prevailing miasm, and we have to treat with anti-miasmatic remedy at proper times. Miasmatic prescription is very necessary in oncogenesis. We have seen the role of miasm in particular stages. There is strong family history of cancer, then carcinosin may be there. If tubercular history, tuberculinum may be there. We have to treat the patient accordingly with family history, with the staging and the miasm which was prevailing at that particular stage of the cancer. Mammography, colonoscopy, PAP, HPV, these must be properly incorporated. Practical prescribing is early initiation and constitutional with antisoric remedies, sulfur, calcaria, phosphor, and so on remedies. Then chronic proliferative stage, psychosis there, then thuja, medoranum, etc. Number of antipsychotic remedies can be used. In destructive, ulcerative, and syphilitic stage, antisyphilitic remedies should be used. In tubercular condition, when there is family history of tuberculosis, or changeability is there, uncertainty is there, chronic inflammation is there, we can use anti-tubercular remedies. Then anti-cancerous remedy like carcinosin or selenum. For neuropathic pain, hypericum, allium, CPATs, etc. For cachexia, fatigue, carboVEG, phosphorus, and so on, caliphos, etc. And for anxiety palliation, ignitia, arsenic, caliphos, aconite, chalcimium, whatever indicated. SORA causes initiation of the oncogenesis, creating constitutional weakness, repair defects, hypersensitivity reactions, and instability. Psychosis causes promotion of the carcinogenesis, leading to excess proliferation, chronic inflammation, overgrowth tendency. Syphilis causes further progression of the cancer by rupture of the cells, by destruction, necrosis of the cells, and by preparing soil for metastasis. This is destruction, ulceration, tissue breakdown, strong influence. Tubercular miasm has tendency to local invasion, rapid spread, alternating weakness and flare patterns, infiltration and fluctuations. Then cancer miasm mixed with another miasm, we have that there is terminal cachexia and death, loss of control, systemic spread, multi-miasmatic collapse is there, and strongest influence is there when cancer miasm is associated with other miasms. Suppose we have a case, 47-year male with 1.8 centimeter thyroid nodule on ultrasound, and FNAC is suspicious. And symptoms are of phosphorus picture like chilly, creative, anxious, unclear, or failure. Phosphorus may be given, but we have to be prepared for biopsy also. If phosphorus, no doubt, treat, but biopsy, if biopsy confirm malignancy, we can coordinate with surgery and go for peri-op arnica and other type of treatment, chemoradiation and homeopathic treatment. If breast carcinoma post-lumpectomy recurrence is there, we are safe and we can give antipsychotic remedy for recurrence. Thuja 200 suppose we are using, and followed by a carcinosin or any constitutional remedy or systemic remedy or particular remedy like phytolacca. We are safe. We can treat patient very well because he is very well diagnosed and there is recurrence and patient has already taken treatment from that particular stream. If there is metastasis with neuropathic pain, a 55-year male with lung primary and bone metastasis, there is severe neuropathic pain. We can treat very well. There is no problem. Take consent, write down each and everything. It should be well documented. and take complete case taking and decide what is the remedy: hypericum, ignitia, arsenic, constitutional remedy, and anti-miasmatic remedy, whatever indicated you can give very safely. Use objective measures like pain scales, Eastern Cooperative Oncology Group performance stages, chemotherapy dose delays, interruptions. We have to write down each and everything, and we can document each and everything regarding treatment in oncology in modern science as well as our science. We have to correlate and we have to use adjunct therapy. Do cancer workup, imaging, biopsy, etc. Do not delay for fear of negligence. Take a full constitutional miasmatic case early, document baseline symptoms, use single remedy at a time, decide potency well, and repeat only when other remedy or other potency is indicated. Record affect the remedy very well and follow details also. Use intercurrent remedies only when clearly indicated. Document rationale and response. Coordinate care closely with oncology and palliative teams. Use objective metrics. You can be in touch with an oncologist while treating a oncological patient for your safety. This is a clinical checklist. Recognize miasmatic expression through symptoms. Strengthen constitutional vitality of the patient. Focus on the tumor microenvironment. Identify phase of carcinogenesis and tumor progression. Integrate miasmatic influences into prescription. Apply miasmatic medicines in a stage-wise manner. Facilitate surgical removal of tumors where necessary. For large tumor, we have to go for surgery. Provide adjuvant therapy following surgery or chemotherapy or radiotherapy for welfare of the patient. This is again SORA initiation, psychosis promotion, syphilis progression, tubercular dormancy, and cancer relapse. This is the clue, and we have to treat accordingly. Clinical red flags are there. There is unexplained weight loss, persistent swelling, non-healing ulcer, and organ dysfunction. These are the clinical red flags. Whenever these are seen, we can think of carcinogenesis is there. Cancer progression follows miasmatic evolution. This has been proved. Homeopathy supports constitution and it not replaces oncology. Integrative approach improves outcomes, and we have to use homeopathy very safely in the domain, and we should not cross the boundaries. We have to treat the patient within homeopathy. In homeopathy domain with similar and similum. We have to not use polypathy. We cannot. We must not do cross-pathy. We should be very dedicated to our patient and should not refuse him for providing treatment. And we should guide for having oncology treatment from other sources also. Thank you very much.
Thank you so much, Doctor. A wonderful session. And the participants, if you have any doubts regarding this subject, you can ask Dr. Ramparvesha sir and Dr. Danesh. You can, Dr. Danesh.
Yes, Dr. Rajneesh Kumar sir, it's really an excellent session. We got a very, a very good idea about these cancer miasms and how we need to manage these cases and what are the things not to be done, what are the things to be that is the importance of examination, and that's the reason why you told about a case of court and in which the doctor was punished not being examining and not confirming the diagnosis of the patient. So it is very, very important to take these things. After all, we all know that diagnosis is not the end of the treatment for homeopathy, but it is the beginning. But we need to do things to confirm whether the patient is having this or that. Yes, sir. What's your opinion on that, sir?
So, diagnosis must. We have to diagnose in time, proper time, because delay in diagnosis is also called negligence. There is a lot of pressure of Indian media and legal body of the government if there is delay in diagnosis, we are negligent. So we should go for immediate pathological, radiological, and any sort of diagnosis. We can use a number of diagnostic tools in our clinics also, which are allowed, and we should not delay in miasmatic diagnosis as well as modern diagnosis.
Yes, sir. Sir, we need some case presentations on cancer from you, sir, in your next session.
Sir, cancer is
Okay.
very readily curable in homeopathy, but we cannot claim because magical claims this is also punishable. And a
Not the
number of
claim, but we can treat, but not
we can treat within domain. We can
claim that I have cured
we
this
cannot
case.
yeah,
We can treat, but we cannot claim. That is
we
the
cannot
only.
we can treat, but we cannot claim. But we have to have the written consent of the patient,
Yeah,
and
exactly. That is
we
the
must do
protocol
proper
for treatment.
diagnosis in time. These are the
Notice.
key.
Thank you, Dr. Danesh. Sir, we have two questions in the chat box from Dr. Zubaida Salam. What is your experience in treating acute myeloid leukemia? Patient already undergone chemotherapy, but with relapse now.
Only palliation is there. Cannot be permanently cured. I have seen a number of cases, but only relief was provided there. No cure was there.
So from Dr. Nancy Malik, sir, little no, it is only the appreciation, not the question. Sir, little light of guidance from about leukemia. That's also she need guidance. We have only 2 minutes.
Next time we can have.
Yeah, next time we'll have a detailed session. If you are answering for 2 minutes, it is not enough to understand the things. Anyway, I'm inviting Dr. Ramparvesha sir for giving out of thanks to Dr. Rajneesh Kumar Sharma.
Thank you, Dr. Anjali, and everyone. Namaskar and congratulations, Dr. Rajneesh Kumar Sharma sir. Very nice, excellent session. Carcinogenesis theory, angle of treatment, symptomological angle, miasmatical angle, and pathological angle. So, according to homeopathy, miasmatical angle is a very good, excellent angle, and curative way of angle, and palliative way of angle जो है cancer, treat the family history and other trauma, grief, anxiety, etc. Main role of mental symptom. So miasmatic angle is a very good angle. So very thanks, Dr. Rajneesh Sharma, behalf of IFPH whole team. Very thanks again presentation. Carcinogen and cancer patient and case. Thank you.
Thank you, Dr. Ramparvesha sir. Thank you, Dr. Rajneesh Kumar Sharma, and thank you all the participants of the English session. Now we are moving to the Malayalam session. Good night, everyone. See you at the same time tomorrow. Thank you once again. I'm inviting Dr. Mariamma John for moderating Malayalam session. Dr. Mariamma John, you are welcome.